Rocky Mountain Spotted Fever, or RMSF. So, a few questions I want you to think about throughout this presentation are: how do you contract RMSF? What is a common disease you contract from ticks? Is RMSF life threatening? What are some symptoms of RMSF? And is RMSF contagious? So, this disease is caused by a pathogen. The Rocky Mountain Spotted Fever is a bacterial disease spread through the bite of a tick infected with the bacteria Rickettsia. It was originally called the black measles because of the look of its rash in the late stages of the illness when the skin turns black. So I was really interested in this topic because when I think of a tick bite, I automatically think of Lyme's disease. And apparently there's more, and I had never even heard of this one, and it sounds pretty gruesome. So the incidence and prevalence. RMSF can be rapidly fatal if not treated within the first 5 days of the symptoms. Before tetracycline antibiotics were available, case fatality rates range from 20 to 80%. It affects over 2,000 people a year in the United States and usually occurs from April until September, which is a lot of people that can die from a disease I'd never even heard of. Although RMSF cases have been reported throughout most of the contiguous United States, 60% of RMSF cases are found in North Carolina, Oklahoma, Arkansas, and Tennessee and Missouri. So here's a timeline of the disease. It's super helpful. So within the first couple days, you're going to have a fever. You're also going to have a headache, myalgia. Then from days 2 to 4, you might begin with a rash, and it's usually around your wrists and your ankles. And then it'll spread centrally. You might have abdominal pain, nausea, vomiting, cough, some calf tenderness. So like this disease affects like a whole lot of your body. So it can affect your skin, it can affect your respiratory with your cough, it also attacks organs. So then days 5 to 7, it progresses and gets worse. So your fever might go over 104, your respiratory gets even worse, your abdominal pain gets worse, the rash becomes widespread all over the body, palms, soles. So then 7 to 9 days, your rash becomes even worse. You get necrosis of the digits, which means like they could have to be cut off. They like die. You can go into septic shock, which is deathly. You can get cardiac arrhythmias. You might get renal failure, pulmonary edema, acute respiratory distress syndrome, cerebral edema, like life-threatening things. So it says that 20 to 25% of untreated cases of RMSF will be fatal, with most deaths occurring within the 7th to 9th day. So, next, is Rocky Mountain Spotted Fever communicable? So RMSF is not contagious and cannot be spread from person to person. So you don't have to worry about like someone touching you and you getting it. To contract RMSF, you have to be bitten by a tick that is infected with the bacterium known as Rickettsia. So not every tick has it. It has to be infected with it already. So the reservoir of infection. So this disease is maintained in nature. So ixoid tick vectors and their hosts. Small animals such as mice, rats, rabbits, possums, chipmunks, squirrels can carry the bacteria in the nature with no signs or illness. So they're like asymptomatic carriers. They have it, but you would never know. Ticks get the bacteria when they feed on the infected wildlife. The ticks then spread it to dogs and humans. So current treatments right now, RMSF can be life-threatening, but early treatment with the antibiotic doxycycline can prevent death and severe illness. Doxycycline is recommended antibiotic treatment for RMSF in adults and children of all ages. It's the most effective antibiotic to treat RMSF, but delaying the treatment of this disease can lead to severe illness or death, with children usually under 5. Doctors tend to not like to give this antibiotic out because it does tend to discolor children's teeth, which is kind of like a random little fact. So I'm sure they're coming out with more antibiotics, but this is just like the number one antibiotic right now. So a great journal article I found that is relative to RMSF is an article that focuses on the Rocky Mountain Spotted Fever within New York City. So it followed 4 cases of people with this disease. So their hospital stays documented all their treatments and what was going on with them. None of these treatments included doxycycline. They had different antibiotics. So like I said, I guess they're using different ones now. And 3 out of the 4 patients in the study survived. So clearly they were treated early enough. But 1 was fatal. So this disease can kill. So, some areas of research regarding mechanisms of disease and creations of the treatment. So, CDC, Division of Vector-Borne Illnesses, they're very familiar with RMSF. So, DVDB is part of CDC's National Center for Emerging and Zoonotic Infectious Diseases. Rickettsial zoonosis brand focuses on special category of bacteria primarily spread by ticks, lice, and fleas. So DVD's vision, mission, and goals are to create a future where vector-borne diseases no longer threaten public health. Mission is to reduce illness, death from vector-borne diseases. So they're trying to prevent, I guess, ticks even having this disease, let alone spreading it. So the goal is to identify and detect vector-borne pathogens that cause the disease in people, which would be ticks, and then understand when, where, how often people are exposed to the vector-borne pathogens. So I listed some places that are high in the area, so they're probably really into looking into that. They also want to prevent exposure to vector-borne pathogens and mitigate consequences of the infection, and they want to implement vector-borne disease diagnostics, surveillance, control, and prevention programs. So the outlook for infected patients with this disease and the range. RMSF can affect the nervous system. Your skin can cause damage to the lining of the blood vessels, tissues, organs if not treated immediately. Complications of RMSF include inflammation of the brain, known as meningitis, leading to seizures and coma, inflammation of the heart and the lungs, kidney failure, gangrene, dead body tissue in the fingers and the toes, like I said, they could be cut off, enlargement of the liver or the spleen, and death if not treated. People who have severe cases of RMSF may end up with long-term health problems, including neurological defects, deafness, hearing loss, muscle weakness, partial paralysis of one side of the body. So that's RMSF. I hope you all learned something. So I want to go back to the few questions that I asked in the beginning. So how do you contract RMSF? So you contract it through a tick bite. What is a common disease you contract from ticks? So other than this one, I feel like one of the most popular is Lyme's disease. Is RMSF life-threatening? Yes, it can be if it's not treated early enough. And what are some of the symptoms? So some of the symptoms include a fever, a rash, respiratory distress, inflammation of the heart, attacking of different organs, many different things. Is RMSF contagious? No, it is not. It does not spread from human to human. It only spreads if an infected tick bites an animal or a human. All right, thank you very much.